kindly introduce yourself so that we get to know you. And with your introduction, please let us know where you studied pharmacy, where you got your pharmacy training, and when, and then also how you got into the practice and what sectors you participated in practice of pharmacy.
Okay. My names are Jeniffer Akinyi Orwa. And if you want my title, we did come out of pharmacy not as doctors, but we struggled to ensure that we come out as doctors. And this was because pharmacy was new in Kenya. And pharmacy has always been a challenge even internationally. As much as the pharmacist actually is the first pioneer of drugs development and treatment. When the medical physicians came on board, they just kicked out the pharmacist. And they feel superior to the pharmacy. So we wanted to make the community realize that pharmacy is also a very important aspect of the medical treatment. So we did get to be called doctors. Fortunately now I'm professor.
Yes.
Thanks to God. So that's my name in a nutshell. And I was in the second pioneer class. The first one started in 74, but mine started in 75 to 79. So we graduated in 1979. And when I graduated, you want to know where I have practiced, right?
Yes.
So I graduated as a pharmacist in 79 and went into hospital pharmacy, practicing hospital pharmacy. And it was not so much of a challenge because we could be able to have the chance of giving more information to the patients. You know, drug information would actually accelerate proper use of medicines. Because if you can dispense good quality drugs, you can access it, but if you don't use it rationally, the way it should be used, then the end result is not well. Yeah. So I worked at Kenyatta National Hospital for 1 year. That was 80 for 3 years, 80 to 84. Then I went to study my master's in the UK. I got master's in pharmacology. I came back in 84 and joined Kenyatta because I was on study leave. So I had my practice improved because now I became a chief pharmacist of the hospital. But then later on, Cambridge started, and they were starting a center for traditional medicine research. And you know, pharmacy, we normally say 80% of drugs come from natural products. But if you ask me, it's 100%. Yeah. So this was a department which was filled by pharmacists, headed by a pharmacist. So I joined Cambridge in 1985, and I was there till I retired.
Oh, wow.
So that's where I have been. I've not worked anywhere else.
Okay.
You need my experiences here, or those ones will come later?
Oh, sure. Those
Okay.
ones would come
Okay.
later.
Yes.
Okay then. I guess maybe touching on what you've just said, I'd imagine you've held many positions of influence in Cambridge, and I guess also as chief pharmacist of Kenyatta.
Yes.
So let us know how how you have served in those sectors, and then also how that has helped pharmacy practice and maybe even training in Kenya.
Kenya.
Yeah.
Okay. As the chief pharmacist, this is influential because, you know, at that point we were able even to direct and give information on how best drugs could be purchased. And this was very important in that at that level now, we were able to talk with the doctors as colleagues as much so that when they write prescriptions. We don't just dispense. If you see some drug interactions and if you see some challenges, you would call them back and rectify the prescription. And I think this is a good contribution to the community, getting, what they need at the right time and properly. So in Cambridge, as I said, I entered as a research scientist because I had already gotten my master's degree. And we started rationalizing the use of traditional medicine in healthcare. Since the Wazungus came, they kind of made us forget about, they actually demonized, that's the word I'm looking for. They demonized the traditional medicine aspect of the African culture. But they didn't do this because they thought it was bad. It's because they wanted to sell their conventional medicines. So, as being trained also in their Western region, we came and said, wow, now traditional medicine is no good. We don't want to accept it. So we had a lot of challenges when we were trying to, rationalize the usefulness of traditional medicine, because now we could do the laboratory work, but then before you go into clinical trials or clinical studies, you need your clinical counterparts to assist in that process. But once they came in with an attitude that they don't really think there is usefulness in traditional medicine use, then it was difficult actually to move further. Yes. So in Cambridge, I worked for a while, then through the years, I moved up, research officer, senior, and those kind of things. And I had an opportunity also to head the department, the Center for Traditional Medicine and Drugs Research. Here is where now I had the authority to organize and see how best we can mentor the incoming professionals. So we had to, like research, now you have to develop proposals so that you can look for funds. The interesting thing is Cambria, they would pay your salary, but to remain relevant, you had to look for funds to do research. So this was something we had to do, write research proposals, look for funds, and carry out research so that we can be able to identify the usefulness of natural products. Although Center for Traditional Medicine and Drugs is there, we did very little about drugs, of course, but since traditional medicine was more interested, we did quite a bit of research on traditional medicine.
I'd imagine this research would have a really good impact on the society, right? So maybe you can expound to us a bit more.
Yeah, because as I said, it was demonized. So we would go into the community and talk with the traditional healers, because also there are those guys who traditional medicine was a secret. It was so much practicing secrecy that they would not want to release information. So it was handed down from generation to generation. But you see now, you have a small community in your area of jurisdiction. So if they are the only ones you treat and you have very good products, they will not reach the whole nation. So slowly we made them understand that we need to carry out research. And then you can't protect a tree. You can only protect the process of making medicines out of that tree. So eventually now the community was free. We had every Wednesday open for the traditional healers as well as the community. So some of them would come to us and seeking for research of their products. These are traditional healers. And then even the patients would come in who are now willing to see the traditional. And if they find that this product has been researched, they were free to use it.
Yes.
And some of them were getting
Better.
much better.
Yes.
Because traditional medicine, okay, sometimes you find diseases which cannot be treated by conventional medicine, like mental diseases, those kind of things. And then some of these chronic diseases, we found that traditional medicine would actually treat them much, much better than the conventional medicine. Yeah, but they have to work in tandem.
That's very interesting. It seems like you have a lot of experience, especially in traditional medicine. So I guess now my question is, how do you think this could impact training and practice in Kenya? So now the question I'm referring to is how would you change training and practice of pharmacy in Kenya or in university or Nairobi, because you're an alumni? Yeah.
It's not just change, it's adding value. Just as I started that 100% of drugs originate from natural products.
Oh.
So they also have a unit of pharmacognosy, which was just identifying drugs and telling you how plants can be identified and probably used. But now if you have to bring in research, then you know how these medicinal plants can actually be improved for wider use in the community. I think the practice would go well, because even the students, even the training would be changed into a proper way of, it's not that it was improper, into a way of starting from the roots, the natural products, the identification, purification, into the conventional products, if you want, or you can end up as the phytochemicals. You don't have to go far. So I believe this is an impact on the training, if I look at the best ways to handle and because even R&D at Cambridge, most R&D, even internationally, we are now going back to the plants to get our source of chemicals to proceed. So
that's a good way.
I believe that's an improvement.
Yes.
Yes.
Okay. And so I'd also like to ask, considering that it doesn't seem like there were many women pioneering, at least it doesn't seem like, because we've not interviewed many women today. So perhaps you could let us know, how has the place of women in studying the pharmacy improved, and or how was it back then?
Just have I said, don't take today is one woman as a reason to say there are no women.
Yes.
There are. It's just that, as I told you before, we did not have the chance to go further in education and reach the point of fellowship. The people you are interviewing today are those who have contributed to the profession, to the pharmacy education, and have been able to be awarded the Fellow Pharmaceutical Society of Kenya. But they're actually women. I told you our class, I think we were almost half-half. Yes, yes. So we are there. But I can tell you now, we are overtaking the men. Yes.
Nice to hear. Okay. Now, going on to...
If I miss any of your answers, you remind me, because sometimes you're asking too many questions and I can't remember all of them.
Oh, I'm sorry.
It's not just avoiding, but
No.
yeah.
You're doing very well so far. Very well so far. I was not going to ask all the questions. I was just asking the key questions.
No problem.
Okay. And so I guess the next one is, what is your vision of the pharmacy field of training and practice in Kenya. So so far we've done 50 years. How about the next 50 years? Where do you see the industry?
Okay. I miss telling you all the positions I had in Cambridge because after working for several years, I did have quite a number of positions because I also moved on to lead a department known as knowledge management. I don't know if you understand what knowledge management is.
Is it the storage of knowledge? Just storing
Yes,
what is
structuring the process of organizing and sharing, utilizing information, and making it useful. Just as I said, if you have good products and they are not used, so now we could do research and publish it, yes, but probably we are publishing it in papers which will not be read by our locals. So we are sending our information out there and they will produce, it will help others to do further research. So we need actually to be able to have our information shared here and locally and stored well so that it can also improve our decision making. So I led this department in the Office of Deputy Director, Resource Development and Knowledge Management. And here, of course, I was able to revitalize the Institute's knowledge management processes and also strengthen the mechanisms of sustained evidence review and use, both at the Ministry of Health and at the county level. And even within this, I was able during my time to launch a Cochrane unit at this department, and I became the director of Cochrane Kenya. Of course, you know, this one is committed to ensuring quality and relevant evidence. And you know, with evidence, if you jump on evidence, then the treatments also are evidence-based. So we get the results we need. So those are some of the positions I held in Cambridge, which I didn't tell you. But where did I get my professorship? I had a sabbatical leave. Then I went to USIU. And USIU, they needed to start the pharmacy school. And they needed somebody like me. I don't know if you know now who I am. so that we could have... you can't start a pharmacy school unless you get accredited by CUE. So I did participate in this accreditation and the start of pharmacy school. So I also spent there 2 years before I went back to Cambridge. So now to come and answer your question, what was it?
My question was on your vision of the pharmacy industry in the next 50 years. What do you want to see improved? Is there anything you want to see changed? What should happen so that we move in the right direction to uphold the pharmacy profession and proper pharmacy practice in the country?
Okay. What is my vision? I would like to see our trained pharmacists being able actually to focus on patient care. So the training should actually improve, not to focus on the drugs only dispensing and taking care of the outpatient, but we need to go into the clinics and advise. And this actually helped because sometimes we had some diseases where the doctors were not able to titrate the amount of medication to give the patient. So by the pharmacists going in there, they are able to advise and be able to, they are the best consultants in drugs. So I would like to see the curriculum in the pharmacy practice focusing on this patient care. And these trained pharmacists would come out with the requisite skills which will now enable them to produce quality services for improved healthcare.
For the patients.
Yeah, so you can shorten that vision.
Okay. No worries. Maybe just a follow-up. Does this also include independent prescription, being able to give independent prescriptions? Because I think what I've gathered from some of the other interviews.
There are some levels. I know some countries are already allowing the pharmacists to prescribe. And you know, right now, even in Kenya, most of the patients, they go to the pharmacy first.
Yes.
Yes?
I do too.
Yes. And then for simple ailments, there is no need to go and queue in the hospital. They could be sorted out at the pharmacy level and be given medication. Then if it is more complicated, which needs proper diagnosis, they could be referred.
Yes.
So that should happen. Yes.
Okay. And maybe now, how do you see this being achieved? How do we achieve this vision? What's I guess the question is, what should be? What is your opinion on how this should be achieved? How the vision should be achieved?
You know, normally I like talking about us. Me, myself.
Yes.
What is my mindset when I come to do pharmacy practice? Am I willing to do what is right? Or I just want, you know, pharmacy is one thing which, apart from being a profession, is also a business. So you need some entrepreneurship training there.
Yes.
But some of us go out to make money, and a lot of it. So we forget about the professional bit. So if we had a proper mindset, all our dreams are
possible.
all our dreams are possible. So I would just say maybe we develop a positive mind as pharmacists so that we can overcome some fears which are really not necessary. We must keep motivated. And if I am a lecturer, I must love and be passionate about my work. Because I can train you on what to do. Very good practices. But if you don't want to, you are not passionate about it, it may not be effective. So being effective, this vision of mine, I think it depends on us.
Yes.
Yeah. How best can we instill a good practices? Yes, it will happen.
Wow. Thank you very much. Maybe just two finishing questions.
Okay.
What would you, Honorable Fellow Dr. Jeniffer Orwa, what would you like to be remembered for in the realm of pharmacy in Kenya?
You know, in Cambridge, they nicknamed me the chief herbalist. The research in herbal medicine, as much as we do research and publish, we are now trying to make sure that our products reach the community. I know we do a lot of research and the community does not see what. But being a champion of knowledge management, now we had started ensuring that the community also benefits from whatever research, because we have to go to them.
Yes.
We have to go to them because they are the ones who are using the traditional medicine. Even in general research, when I want to have a sample to interview, I still go to the community. But you see, they were mostly complaining, you researchers, you come to us, but we don't know what you do with whatever you get. We publish and forget about it.
Yes.
Yeah, so this is what knowledge management is trying to do, ensure that we impact on the community by ensuring that what we get is actually useful to the community.
Okay. Thank you. And so, as a parting shot, please take this opportunity to send a message of congratulations to your alma mater and other UN pharmacy alumni on celebrating 50 years. You know, it's not a small feat, but just give us your message of congratulations.
Okay, yes, indeed, I would like to extend my congratulations to the University of Nairobi Pharmacy alumni, and of course, its networks, because it's supported by networks like you. You are not UAN. This really ensured that our profession advances in technology, research, clinical care, and all these have shaped the profession over the last 50 years. And it's not a small feat. I need to congratulate ourselves for having done this. And I wish us to keep up
the good work.
The good work and continue encouraging our young pharmacists to, if not follow our footsteps, try and do better than us. Yes.
Okay. Thank you very much. Appreciate your time and we appreciate you organizing this. It's been very lovely.
Thank you.
Thank you.
Yes.